Hi, I'm Scotty. I'm a student nurse at the University of Charleston in Beckley, West Virginia. Today I'd like to speak with you about disseminated intravascular coagulation, which is also known as DIC. Our blood is made up of three types of cells. White blood cells fight germs and illnesses, red blood cells carry oxygen throughout the body, and the platelets help the body clot blood and fight bleeding. DIC is an illness where you can either bleed too easily, the blood clots too easily, or both happen at the same time. This may occur very slowly or very quickly, and it can happen in both men and women of any age. It is most often brought about by other illnesses in the body and may happen after pregnancy, cancer, or a bad infection. When you have this illness, your blood may form blood clots even when not needed. These blood clots stick to the blood vessels and may cut off blood supply to an organ. This can cause a lot of serious health concerns. By the time healthy clotting is needed because of an injury or bleeding, your body will have a hard time because many of the clotting factors have already been used. Some signs and symptoms of DIC are bleeding into the skin, such as cutaneous oozing, petechiae, ecchymosis, hematomas, as well as bleeding from surgical or invasive procedures, such as incisions and venipuncture sites. Some risk factors for DIC are cancer, blood transfusions, severe tissue injury, sepsis, and surgery. Now, some expected laboratory factors of DIC are decreased serum platelets of less than 150,000 milliliters, decreased serum fibrinogen levels less than 170 milligrams per deciliter. The prothrombin time is prolonged more than 19 seconds, and blood clotting factors 5 and 8 are diminished. Blood urea nitrogen levels and serum creatinine levels are elevated, and a urinalysis may indicate hematuria. Now, some nursing interventions for managing DIC is to institute bleeding precautions to minimize the patient's risk of injury. If bleeding does occur, use pressure and topical hemostatic agents to control the bleeding. Administer blood component therapy as ordered with careful monitoring for transfusion reactions and signs of fluid overload. Venipunctures and invasive procedures should be limited whenever possible. It's essential to measure the amount of blood lost, weigh dressings, linens, and record the drainage. Now, some treatment options for DIC are replacement therapy and the administration of fresh frozen plasma, platelets, fibrinogen concentrates, or cryoprecipitate. Anticoagulants such as unfractioned heparin, antifibrinolytic agents such as aminocaproic acid, broad-spectrum antibiotics, fluid replacement, and oxygen administration. The prognosis of patients with DIC depends on the severity of the coagulopathy and on the underlying condition that led to DIC. The primary focus must be on early recognition of signs and symptoms of abnormal bleeding, prompt treatment of the underlying disorders, and prevention of further bleeding. This information was provided by Lippincott Advisor for Education, 2020 Walters Cleural Health, Incorporated.